name's Maria Makrides and I'm the theme leader for SAHMRI Women and Kids, based at the South Australian Health and Medical Research Institute in Adelaide. I started my research life as a dietitian after having done a science degree at the University of Melbourne and then a Bachelor of Nutrition and Dietetics at Flinders University here in Adelaide. I worked out pretty quickly that I wanted to work more in research rather than being a clinical dietitian. So I took the opportunity to do a PhD in paediatric nutrition and was involved in some of the first studies to work out the omega-3 requirements for term babies. I've continued to work in the field of omega-3 fatty acids, probably for the last 25 years or so. So it has been a long journey and the field has evolved a lot during that time. We've gone from not really understanding the role of omega-3 fatty acids may play to supporting the healthy development of babies, both those born at term as well as those that are born early. Some of the earliest work that I was involved with as part of my PhD and led was doing the very first supplementation studies of adding these omega-3 fatty acids to infant formulas. The reason why we thought that that may have been important is that in the early 90s there were many studies showing a lot of developmental differences between babies that were fed infant formulas compared to those who were breastfed. At that time, most infant formulas, or all infant formulas, did not have added omega-3 fatty acids, whereas breast milk had a full spectrum of all omega-3 fatty acids. In fact, most infant formulas had a preponderance of the omega-6 fatty acids and even very few of the precursor fatty acids. So the very early studies were really doing supplementation studies, and what we managed to show is that when omega-3s are added to those early style of infant formulas, that we were able to improve the visual development of babies who were formula fed and otherwise had no omega-3 fatty acids in their diet. Obviously the field has evolved hugely since then and the quality of the infant formulas has changed, but a lot of the more recent work has been about how do we support the development of those babies that are born very early. And these babies that are born so early miss the last trimester of pregnancy, which is a time that these omega-3 fatty acids are accumulated into the brain when it has its brain growth spurt. And this particular fatty acid called DHA makes up about a third of all the lipid in the brain, so is thought to have quite an important role. So the field has evolved to be more than just thinking about infant formula and breast milk and looking at the requirements. So the babies that are born very early, we think have requirements that are above what is currently in the diet, either from the mother's expressed breast milk or the supplemented formula. So we have developed and tested an emulsion that can be added to whatever the baby is fed to try and meet what it would have if it was still in the womb. And what we've managed to show is that for the very preterm babies, by meeting that in utero requirement, we can improve the development of those babies and improve their IQ out at 5 years of age. The impact of the work, particularly the trials that we've done here in Adelaide, as well as many other people around the world, has been to legislate changes in the composition of infant formulas so that there are minimum levels for the precursor omega-3 fatty acid called alpha-linolenic acid, and also allowing the optional addition of the longer chain omega-3 fatty acids for term babies as well as for preterm babies. So those legislative changes have been made in over 180 countries around the world. Well, what drives the passion in the work is really about building from making sure that there's a strong foundation and then building on that and the next step and the next step to really try and make solid change for the long-term health of children and babies everywhere. Outside of work, as a nutritionist, I love having dinner parties and I love sitting around with friends and colleagues over a table and sharing a lovely meal. I love long beach walks and really walking out in nature.